Disease resistance remains one of the challenges facing the health sector in developing countries, including Uganda. Even when there are several antibiotics on the market, bacteria-causing diseases have continued to be resistant, leaving thousands bedridden in various hospitals.
So antimicrobial resistance, in a way, is becoming very dangerous because time may come when there are no drugs that are effective enough to be able to treat some of the common diseases. You pump someone with the drugs, even the most expensive drugs, but then the bugs are not dying, and this person continues to become more sick.
According to Dr. Ngozi Joseph, the Dean Faculty of Medicine at Mbarara University of Science and Technology, some bacteria have developed a tendency of mutating into a form that is able to resist the effect of the drugs. As such, some patients continue suffering from a similar disease and can end up claiming their lives.
There's some resistance towards some of the common antibiotics we are using. Ampicillin, ampiclox, penicillin, so there are quite a number of them.
Sometimes people do not need an antibiotic, but then they take an antibiotic. Sometimes they use the wrong antibiotic, maybe because they've gone and picked an antibiotic without a prescription. So importantly, we must only use antibiotics in humans with a prescription. That means a doctor or health worker has to write and say, this is the antibiotic you need. And then the person has to complete and follow that prescription, complete their medication. If they do not complete their medication, they are giving the bacteria a chance to survive. But as they survive, they also acquire resistance to the antibiotics.
The antimicrobial resistance is facing all developing countries in the world. Mohamed Lamude, the head of Department Global Health Security and Infectious Disease Institute at Macquarie University, says this may escalate into mass deaths if developing countries don't swiftly step up to develop new antibiotics.
It's important to know that this is not a small issue, and globally it has been agreed that if nothing is done, antibiotic resistance, antimicrobial resistance more broadly, may cause more deaths than even HIV and malaria.
This as the Infectious Disease Institute and the Global Health Security Program, with funding from the UK Department of Health and Social Care, handed over a fully refurbished Biosector Level 2 microbiology laboratory equipment to Mbarara University of Science and Technology. This laboratory will support antimicrobial resistance surveillance and provision of diagnostic microbiology services for patient care.
So the lab will be able to do quite a lot of microbiology work, and they will tell us, you know what, you have this infection in the urine, and this is its type. But then on the available drugs on the market, these drugs are effective. So please go buy these drugs that will be able to kill the bugs according to the disease that you have.
The state-of-the-art Billion Laboratory is the first of its kind in the region, and it will be providing free services to Ugandans that need body checkups.
So much.
Victoria Vagaya, Ambrose Muhumuza, NBS, Live at 9.